Now with me, Aisha Faridi. And the first up, India has reported its biggest single-day spike in fresh COVID-19 cases in over 2 months. India has reported 22,854 fresh cases in the last 24 hours alone. In fact, new cases have crossed the 22,000 mark for the first time since December 26, 2020. Nearly 18,000 people recovered from COVID-19 in the last 24 hours, while 126 lost their lives. The Health Ministry has vaccinated over 13.17 lakh people since yesterday, taking the total number of beneficiaries to 2.56 crores. And given that for the first time in 6 months, Maharashtra has recorded over 13,000 new COVID cases, the state has recorded 13,659 positive cases and 54 deaths just yesterday alone. It was in October last year, remember, that Maharashtra had reported over 18,000 daily COVID cases, which was the highest since the pandemic broke out earlier in 2020. Fresh new curbs in twin townships of Kalyan, Dombivli, where non-essential shops cannot stay open more than 6 days a week and beyond 7 p.m. any day. In fact, a Janta curfew has been imposed in Jalgaon and will be observed on March 12th, 13th and 14th. No weddings are allowed in Nashik from March 15th. The weekend lockdown, along with several restrictions, has been imposed. From March 15th onwards, schools for classes 5th to 8th will remain shut till further notice in the rural areas. In fact, Maharashtra Chief Minister Uddhav Thackeray said that the state government does not want a lockdown, but since cases are rising, a decision will have to be taken soon.
मेरा आज भी यही कहना है कि लॉकडाउन करना सब लोग चाहते हैं, नहीं चाहते हैं। लॉकडाउन तो कोई पसंद नहीं करता, हम भी नहीं करते, पसंद नहीं करते, हम भी नहीं चाहते कि लोगों के ऊपर पाबंदी लगाए। तो इसलिए अभी तक तो सेशन चल रहा था और आप देख रहे हो कि लगातार इसमें बढ़त हो रही है और कुछ ना कुछ डिसीजन तो लेना होगा।
In fact, let's take stock of what the situation is currently on ground in the state of Maharashtra. We have with us Dr. Shashank Joshi, the Dean, Indian College of Physicians and Consultant, Lilavati Hospital, joining in on the phone line right now. Dr. Joshi, thank you so much for taking the time out and speaking with us today on ET Now. Help us understand what is leading to such a huge spike in cases.
So don't go by absolute numbers. We are testing extensively more. The testing frequency has gone up exponentially. The good thing is recovery rate is more than 90%, death rate and case fatality rate is 0.5%. So that is a reassuring thing. But definitely the doubling time has gone down and the test positivity rate in some geographies has gone above 15%. All those geographies where the hotspots, where the test positivity rate is more than 15%, they will be micro-containment. And between 5 to 15%, a red alert has been sounded. Below 5%, of course, there is nothing to panic, but we would love to have a test positivity rate of 1 to 2%. So I think clearly the masking message has to be mandatory. We need to do rapid vaccination of our vulnerable groups. And I think people and citizens in general need to be more responsible for their own health. I think that is the key thing. If that doesn't happen, people are still reckless, people are still careless, and I think that they feel that they are past COVID, but that's not true at all.
Absolutely, and you know, that's exactly what I wanted to talk about, because in Mumbai alone, we've seen over 1,500 cases recorded after 5 months. The round-the-clock vaccinations, although have begun already, and they're going to kickstart and aggravate further from next week. What is the solution then, Dr. Joshi, if indeed, we don't have cases come off with regards to fresh infections? Would you say that what we're seeing in areas like Dombivli, or for that matter Nashik, wherein there are strict curbs on non-essential shops being shut after a particular time and mini lockdown, so to speak, over the weekends? I mean, is that the solution? Is that where even a city like Mumbai is headed towards?
No, I don't think that is a solution at all. In fact, that's the last thing we want. But people need to shop responsibly. They need to crowd less. They need to have more aeration. temperature is changing. So I think people need to be more responsive. They don't have to overcrowd a particular place at a particular time. So I think all the citizens need to cooperate here. And if they don't cooperate, the last thing people want is a lockdown. Micro-containment will definitely occur, and I don't see a challenge. And Mumbai still is having a TPR of around 5%. So I'm not that worried about Mumbai, except some clusters and spots. And remember now, most of the COVID which is occurring in Mumbai is happening in middle class and above middle class. And in the lower socioeconomic strata, actually, the case reporters, even in places like Dharavi, is only 5 or 10 or 15. It has not really gone up at all. And if you see our public hospitals, most of the beds there are empty from COVID. They are doing all non-COVID work. But if you see the private hospitals, they are the ones who are having occupancy from the COVID beds. The good thing is that there's a lot of availability of beds and ICUs. And basically, lockdown-like measures are mainly for health preparedness. And the healthcare infrastructure is ready. But I think it's people who need to behave themselves so that we can avoid all these measures which can hurt economy. And it's very, very crucial that people become more responsive and behave like places like Singapore, where they can go in batches for shopping and they can have local, norms and which are adaptable, which are acceptable to the community. So I think we need to have a larger local community participation to get around these numbers and curb COVID.
Yeah, absolutely. Dr. Joshi, thank you so much for taking the time out and speaking with us. Hopefully, we shall recover from this fresh wave of, the spike in cases that we're seeing currently, especially in the state of Maharashtra.